At that time, I'd like to inform today's conference. I'd like to now Catherine Barnett. Thank you.
Good afternoon and welcome. My name is Captain Francine Barnett, and I'm the Acting Director for the Division of Commission Personnel Support. I'm also a practicing occupational therapist by trade, so a quick shout out to any OTs on the line since April is OT month. I want to thank you for taking the time out of your busy schedule to join today's call. I would like to introduce our guest speaker today, Admiral Buchanan, Deputy Director for the Indian Health Service. He will provide a few opening remarks. Admiral Buchanan.
Thanks, Captain Barnett, and shout out back to you for the occupational therapy category. Great to recognize hard workers in the category, so thank you for all that you do. And thanks to all who are able to take the time out of their busy schedule today to join us for this call. During last month's all-hands call, as I understand, we had over 300 officers attend that call. We currently have some competing priorities right now. We've got a White House call that is going on. An IHS director is visiting in Montana, and we also have the annual tribal budget formulation also going on. So hopefully we can get to those numbers, but understand the turnout may be a little light today, but always glad to join this call and appreciate those that have joined the call. A lot has happened since our last call in March. I will leave the details and updates to the Division of Commission Personnel Support, Captain Barnett's team, Lieutenant Commander Hatch and Ms. Davidson and Captain Verdugo. Such an incredible team to work with at DCPS. I will touch on the priority areas for the agency, department, and the White House as it relates to the Commission Corps deployments. As we are all aware, the influx of unaccompanied children at the southern border is an emergent situation that impacts the national security on top of the ongoing COVID-19 pandemic. It appears that we're not done with the pandemic. As some of you have joined the ICS, we reported we've got some increased averages. Our 7-day averages in Bemidji and Portland and Tucson seems to be creeping higher and higher. Bemidji up in the 9.7% range, so definitely not done with COVID-19. It's here for a while, and want to recognize all the officers out there that have participated in those ongoing efforts to fight COVID-19. As most are aware, Secretary Becerra has deemed it appropriate to deploy members of the USPHS Commission Corps pursuant to the authority of 42 USC 204A. As some of you are aware, we've been getting deployment requests across the agency as an announcement went out, but with Ms. Fowler and DCPS and OHR working closely to highlight the need to have a process for deployments as to not disrupt our patient care system. IHS received support from Surgeon General Murphy and confirmed that Commission Corps headquarters will not deploy IHS officers who are on the IHS mission critical list. DCPS and OHR continue to work with Admiral Ortega, Commission Corps headquarters, on the deployment of 238 officers who have been deemed eligible for immediate deployment by their area directors and CEOs. We currently have 5 deployed for the unaccompanied children mission. DCPS anticipates as the unaccompanied children's mission requirements are received by the Readiness and Deployment Branch, IHS officers will be matched. We ask that officers reach out to their regional liaisons to confirm their deployment information as they receive it. Just want to make sure that everybody is aware of the March 30th email that Ms. Fowler went out. Points to the fact of the importance for area directors and CEOs to make sure they're keeping those mission critical lists accurate and well thought out. As we all know, Commission Corps officers serve to protect, promote, and advance the health and safety of our nation. We are fully deployable and always ready national assets that preserve public health and national security during national global public health emergencies. Officers who are on deployment should be patient and flexible, as most of us who have been deployed know that whether it's a flood, hurricane, COVID pandemic, the UC missions, you name it, within our agency. Definitely things are changing all the time. The situations are changing. It's fluid. Those situations on the ground can change at a moment's notice. But one thing that we all know is that we have to be patient and flexible when we're on those deployments. I want to thank you for all that you guys are doing out there to meet the mission of IHS, providing care and services to our patients, and to those who have answered the call to fight COVID-19 and the unaccompanied children's mission. I know there's a lot of topics to cover, from core updates, leave, travel, assignment pay, and everyone's favorite question and answer section. So I'll end my comments there and turn it over to Lieutenant Commander Hatch. Thank you.
Thank you, Admiral Buchanan, for your remarks and for joining us today. This is Lieutenant Commander Hatch, Navajo Region Liaison. And the agenda for today's call will include Commission Corps updates. We will hear about leave, E-Corps, alternate work schedules. We will also hear about foreign travel, assignment pay, and then we will have a live question and answer session. Moving on to Commission Corps updates. First, we would like to recognize and welcome the new Assistant Secretary for Health, Dr. Rachel Levine, who is now the 17th Assistant Secretary for Health. We'd also like to welcome back Vice Admiral Vivek Murthy, who has rejoined the Public Health Service as the 21st Surgeon General. Both have been confirmed by the Senate and sworn in. Regarding retirement pay, all PHS Commission Corps officers receiving retirement pay is processed by the U.S. Coast Guard. The U.S. Coast Guard recently changed the forms used to establish an officer's retirement pay, and the new correct form is the DD 2656. Any officers who have already submitted their retirement package, including the old form, which was the Coast Guard 4700 form, it will still be accepted, and you will not have to submit the new form. But please be aware, any officer who is currently working on their retirement package or will be in the near future, please just make sure you reach out and contact your Commission Corps liaison and ensure that you have the correct form. Basic Life Support, or BLS, has been extended by CCHQ through June of this year. All officers must complete and upload documentation of an approved BLS recertification through eDocu by June 30th, 2021, before the next readiness check, which will be on July 1st. COVID-19 vaccine. CCHQ continues to encourage all officers to receive the COVID-19 vaccine by any means possible. For many of us, that will include through IHS facilities, could be through state or county programs, private sector, or military treatment facilities, also known as MTFs. All PHS officers are considered to be in Phase 1B priority. To help in obtaining a COVID-19 vaccine, if you are having any difficulty, there is a signed memo from Rear Admiral Susan Ortega, who at the time was the Acting Surgeon General, and this memo is available in the Officer Secure area under the Commission Corps Modernization tab. This memo can be used to validate the Phase 1B priority to any MTF, military treatment facility, or any other health departments and facilities. As a reminder, if you are trying to obtain a vaccination at a military treatment facility, you must be in uniform and have a valid identification card. And also, as a reminder, please upload any documentation of each COVID-19 vaccine dose you receive into your EOPF using eDocu. The new physical training uniforms, or PTUs, have been available to purchase through the Navy Exchange web store since February. There have been some reports and concerns in the quality and durability of the PTUs, specifically the anchor and caduce peeling off, along with the questionable placement of the anchor and caduce on the fleece hoodie. CCHQ is aware of this and is currently working with the Navy Exchange Command to resolve these issues. If you have already purchased your PTUs and feel they are defective, the Navy Exchange has stated they will replace or provide a 100% refund. For those who have not purchased their PTUs, CCHQ has stated they will provide a follow-up message once these issues are resolved. assignment pay. Despite being announced by CCHQ on April 1st, this is not an April Fool's joke, and we will be hearing much more about assignment pay later in today's call. So stay tuned. This is exciting news for many of our officers. The summer white uniform is now authorized for wear. As a reminder, the National Uniform Authority has requested that all Commissioned Corps officers continue to wear their ODU uniform until further notice as we continue to respond to the COVID-19 outbreak. However, the summer whites may be authorized by your local uniform authority for special situations such as attending or presenting at a conference. The Unaccompanied Children's Program, this was mentioned earlier by Admiral Buchanan. Just to reiterate that we will continue to work closely with area directors, IHS leadership, and CCHQ in the future to support this mission while also balancing the needs and staffing within IHS. Finally, CCHQ has reintroduced the Commissioned Corps Bulletin. This bulletin was first established in the early 1980s, and now a new revamped bulletin will serve as a way for CCHQ to communicate important information, updates, deadlines, and reminders to officers on a monthly basis. This bulletin will be distributed through the Commissioned Corps listserv on the first Monday of each month, and it can also be found on the CCMIS website. Thank you. That's all for the updates, and I will now turn the time over to Ms. Robin Davidson.
Thank you, Lieutenant Commander Hatch. Good afternoon, officers. My name is Robin Davidson. I am currently the Acting Deputy Director for DCPS. In addition, I am also the Northern Plains Regional Liaison. The topics I will be covering are leave, E-Corps, alternate work schedules. The Commissioned Corps instructions that govern the leave is Commissioned Corps Instruction 361.01, Leave of Absence General, CCI 36201, Annual Leave, CCI 363.01, Sick Leave, and CCI 29.1.5, Absence Without Leave. The true purpose of leave for officers is to allow the officer to rest, recuperate both mentally and physically. Commissioned officers are subject to call to duty 24 hours a day, 7 days a week. Therefore, officers are not eligible for overtime or compensatory time when they work longer than 8 hours a day and more than 40 hours a week. Except in cases of emergency, all leave must be taken by the officer and approved in advance by the officer's leave granting authority. Since the officer is subject to recall to duty at any time from leave and is required to keep their leave granting authority informed of their whereabouts during any period of leave, including sick leave. To maximize the benefits from the purpose of leave, officers should be afforded opportunities to take frequent periods of leave, including and whenever possible. The recommendation is at least one extended leave period each year for approximately 14 days of consecutive day in length or longer. Now, we also know that it is a significant challenge currently in our current austere environment with COVID, but we do encourage officers to take leave if and when they can. As you can see on this slide, there are several different leave types, and we will not be going through all of these. But I wanted to let you know that we will be going over the most significant and most used types of leave. First type is annual leave, and it is the most widely used leave type. It is any period that is charged in full days when an officer is relieved from working their normal schedule, and this includes any non-work days falling within that such period. Annual leave, and I will emphasize, annual leave must be submitted by the officer through the Electronic Commissioned Officer Resources Processing System, which is better known as E-Corps. I will reemphasize, please submit your leave in E-Corps. Here you will see is a few examples of how to appropriately submit your annual leave request when it comes to weekends and holidays. If the leave type is the same and it is at the front and back end of a weekend or holiday, annual leave must be requested for the entire period of time covered. If the leave type is different, for example, the sick leave is at the front end because you have a doctor's appointment on 12 March 2021, and the annual leave is the 16th and 17th of March, you are not required to take annual leave over that weekend. Sick leave. Sick leave is defined when an officer is in need of medical services or incapacitated for the performance of duties by sickness, injury, pregnancy, or postpartum recovery period. There is no actual accrual of sick leave under the core leave system. However, sick leave is not without limits. Sick leave must be approved by your supervisor prior to the start of your duty day. This leave can be submitted retroactively through eCore, but at least the approval needs to be approved ahead of time. Sick leave is not authorized for the care of a family member, regardless of the dependency status. Annual leave could be granted for this purpose. Leave granting authority may require an officer to remain in the vicinity of his or her duty station while the officer is on approved sick leave. And your leave granting authority can ask for a doctor's note to account for the medical appointment. Station leave. Station leave is not a right. It is a privilege, which shall be granted prudently and only for legitimate reasons. Station leave is an absence from duty or station under the following conditions: during off-work hours on 2 consecutive workdays, on a non-workday unless the non-workday falls within a period of annual leave, and for a period of less than 1 workday. The purpose of station leave is to complete tasks that cannot be done after hours. So a few examples of appropriate use of station leave is if an officer needs to go to the post office to mail a box, or if you're registering a child for school, if an officer needs to attend a child parent-teacher conference attendance, or if an officer needs to renew their common access card or military ID card at the nearest Deers Rapid Service Unit station. Administrative leave is an absence for a full workday or more than is normally charged to annual leave. However, there may be situations in which the absence of the officer would be advantageous to both the officer and the Corps. Administrative leave is limited to 5 days per calendar year and will be limited to the number of days required for the purpose in which it's granted. A few examples of the appropriate use of administrative leave would be to attend any professional meetings, professional examinations, or even a state or licensure or specialty board certification. In addition, administrative leave can be authorized in conjunction with a permanent change of station or what we call a transfer. Officers can be granted, and let me say granted because you need to get supervisory or leave approving official approval in conjunction with their permanent change of station or transfer. Officers can grant up to 3 days before departing their old duty station and up to 3 days upon reporting to the new duty station. Really, the intent and purpose of these 3 days is so that you can have your household goods packed out and packed back in. This allows the officer time to arrange for the movement of household goods. Permits of temporary duty. It's authorized administrative absence to attend or participate in designated official or semi-official programs. It is non-chargeable leave to the officer. A few types of authorized permissive TDYs include, but are not limited to, attendance at a national convention or meeting, accompanying a dependent patient, and participating in recruiting activities. Paternity leave is non-chargeable leave not to exceed 10 consecutive days. These 10 days need to run consecutively from start to finish. Holidays, weekends, and other non-duty days are included in that 10 consecutive day calculation. Paternity leave must be taken within 45 days after the birth of the child. It also can be used in conjunction with annual leave. If the leave is not used within an established time frame, the leave is forfeited. Maternity leave. Maternity leave is authorized for an officer to give birth to a child. It is non-chargeable leave authorized up to 12 weeks or 84 consecutive days for any postpartum, normal, or cesarean recovery after delivery. Maternity leave starts the day that the member is released from the hospital. Post-deployment respite absence, and I will say that this slide is probably most accurate at our current state of all the deployments that our officers are being requested to go on to. The post-deployment respite absence is usually specifically used for officers that are returning from a public health emergency or national crisis deployment. This provides the officers time to rest and recuperate from the physical and psychological toll that is placed on officers during a deployment. The leave is not charged to the officer, and the officer must be deployed for 14 or more consecutive days away from their place of duty with at least a 50-mile radius from their place of duty. Post-deployment respite absence must start within 48 hours upon returning to the officer's permanent duty station and will be used consecutively. PDRA cannot be saved and used at a later date. It may be used in conjunction with any other type of leave as authorized by your leave granting authority. Absent without leave. An officer will be considered absent without leave if the officer is not at work during regular scheduled duty hours and is not on an approved leave status. It is the determination by the leave granting authority. AWOL status ends when the officer reports in a manner acceptable to the leave granting authority. Once an officer is placed on AWOL status, the officer will have the following: forfeiture of pay and allowances, costs for travel and transportation of household goods will not be allowed, the officer's annual leave will not accrue, and will not be entitled to receive disability retirement pay or disability separation pay for a disability that is incurred, or in this case, a pre-existing condition aggravated while on AWOL status. In addition, if an officer is placed on absent without leave, you will not receive credit fulfillment for the following: special or incentive pay agreement obligations, active duty service obligations, or scholarship programs, in this instance, the National Health Service Corps Scholarship Program. An officer who is AWOL for 30 consecutive days or more may be summarily terminated by Commission Corps Headquarters. Service members will receive a statement of service with it listed as dropped from roles. In the case where absent without leave is unavoidable, which means it's no fault of the officer, a determination by the leave granting authority that the absence was unavoidable must be based on reason. A few of the reasons that the leave granting authority can overturn an AWOL request is if the officer is unable to report to the duty station for causes beyond the officer's control and has contacted the leave granting authority by telephone call, email, or text message. If the absence was caused by mental or physical incapacity and documented by the officer's primary care manager, or an unavoidable restriction of the freedom of movement or evacuation orders, such as emergency shelter in place or road closures. This does not include incarceration. The Electronic Commission Officer Resource Processing System, or better known as ECOR, is the sole system of record for requesting and approving leave. We are aware that there are some of the leave types that have not been updated in ECOR. In that case, they can be requested and submitted on the PHS 1345 request for leave. Password resets are requested and can be sent to the email associated with your account in ECOR. To update your email address, the officer will need to update the email address attached to your Officer Secure Area Readiness and Deployment Self-Service. If you currently have outstanding leave confirmations, they are approved one at a time. So if your current leave confirmation process has not been approved by your leave approving official, you will not receive any future leave confirmations until the current confirmation process has been completed. Currently, as of yesterday morning, there are 1,412 outstanding leave approvals or confirmations that are currently pending in eCore. Please reach out to your leave approving officials and have them log into eCore to ensure that leave is approved and confirmed in a timely manner. This is actually a picture from eCore. So if officers want to know what their current leave balance is, they would click on the My Profile on their homepage in eCore. And then subsequently on the left-hand side, there is the leave balance, and it has it broken out by the different types. As you can see at the very top, there is now a new annual excessive leave block. This is for those leave days that were carried over in September 30th or 1 October of last year based upon the current COVID-19 mission. We encourage officers to use their annual 2020 excess leave in a timely manner. You must use the excess leave from FY 2020 no later than 30 September of 2023. For officers, usernames are posted on the Officer Secure Area dashboard on the Commission Corps Management Information System website. Commission Corps agency liaisons and civilian users should receive usernames by email. If your leave approving official cannot remember their username or they cannot remember their password, please reach out to your regional liaison and we can provide that username and we can also reset the password. For officers, password resets are requested and will be sent to the email associated with your account in eCore. If you cannot remember the account that is within eCore, please reach out to your regional liaisons and we can also reset your password. Moving on to alternate work schedules. Alternate work schedules for commissioned officers may be authorized. We encourage you to reach out to your first line supervisor to see if an alternate work schedule is available for you. Taking leave in conjunction with being on an alternate work schedule, you are charged leave based upon your applicable shift. Any days that you are required to be at work, you will submit annual leave for. For those days that you are not scheduled to be on shift, annual leave is not required. The importance is to communicate with your leadership about alternate work schedules. In this example, you can see a few of the most common alternate work schedules that we've seen through DCPS. First one being a compressed work schedule, 4 days, 10-hour shifts, a modified work schedule, 1 week on, 1 week off, and lastly, a Panama shift schedule. It means you are 6 days on, 5 days off, 5 days on, 6 days off. Again, if you have any issues with your leave balance or issues with eCore, please reach out to your regional liaison first. We can review your account to see if it is incomplete, and we can provide any action that needs to be done within your system. Thank you very much. I will go ahead and pass it over to Captain Verdugo, who will be going over the next topic of foreign travel.
Thank you, Ms. Davidson, and good afternoon, everybody. I have the privilege of going over 2 topics this afternoon. First, I'll delve into foreign travel, and subsequent to that, I'll go over assignment pay. So, foreign travel. And I'll just give the caveat on foreign travel. We had a great overview of leave, and just as a reminder that we have been asked to limit leave due to the unaccompanied children mission, and so this may not be the best time to plan foreign travel, but certainly in the future, if you have the opportunity to do foreign travel, these are some important considerations for Commission Corps officers. So in starting with applicability, so Security Executive Agent Directive 3, HHS travelers who have been granted access to classified information or hold sensitive positions are required to report not only official but unofficial travel to the HHS Office of National Security. So who does that apply to? Well, it actually applies to all officers. In accordance with CCI 230.04, the recently released National Security and Suitability Background Investigation policy, regular Corps officers must maintain Tier 3 clearance, and Tier 3 clearance equates to being in a position where you may have access to sensitive information. And some officers actually hold positions where they have Tier 5 clearance, which means you may have access to or be eligible for top secret clearance. So all officers need to follow the process that I'm going to be explaining. So there are two forms that you need to be aware of. The first form is the HHS 845, and that's the form that you fill out before you depart. That form needs to be completed 30 days prior to any foreign travel. Again, whether it's official or non-official, you need to complete the HHS 845. When you complete your travel and you return, you need to complete the HHS 844, the post-travel follow-up form. And that needs to be submitted within 5 days of your return from foreign travel. You'll notice when you look at the form, it asks about foreign contact. And so it asks about planned and unplanned contact, but what does contact really mean? So initial contact is defined as close and continuing or sharing of personal information. And if it does continue, you need to update the relationship that you have with foreign contacts whenever there's a change in that contact, such as you increase in the frequency of contacts, you decrease in the frequency, or you had a previously existing foreign contact that now has that relationship has ended or ceased. And those forms need to be submitted to two different mailboxes, international at hhs.gov and SSO at hhs.gov. Those mailboxes are managed by the HHS Office of Security and Strategic Information. The next thing you want to do when you're thinking about doing foreign travel is review and follow the HHS foreign travel checklist steps. And they're located at that website that I've listed there. That website is found within the intranet, the HHS intranet. So if you're at a tribal site or an urban site and you're not on the D1 network, you wouldn't have access to that necessarily. So please reach out to your regional servicing liaison team and we can get you access to that information. Additionally, when you're thinking about foreign travel, it makes a lot of sense to go ahead and sign up for the Smart Travelers Enrollment Program, and that is managed by the State Department. And what that'll do is enable you to sign up, and you can indicate the location that you intend to travel to, and you'll get very informative updates about security concerns and other travel-related information to prepare you for your travel planning and help to also provide you alerts while you are completing your travel. Next, you should review the HHS Office of National Security Foreign Travel Briefing, and that is provided, that briefing is provided to you after you submit your pre-travel approval form. They will in turn, once they receive it, provide you with that briefing document. And then combined with signing up for the Smart Travelers Enrollment Program, you'll have the information that you need to be aware of any potential counterintelligence or security threats. So some good tips to be mindful of when you are completing foreign travel. First, you shouldn't discuss any sensitive matters where they could be overheard while you're on foreign travel. In fact, you should be thinking about, do I need to share? Is there really a need to know for people that I might come in contact when I'm engaging in foreign travel, for them to know that I work for the U.S. government or know any particulars about my position? You want to ensure that you secure information that is valuable to your department. So that includes what the bullet at the bottom, not leaving your laptop, computer, phone, or other sensitive documents unattended if you're traveling with them. And in fact, ask yourself the question, do I really need to bring my laptop with me? Certainly, is there a need for me to bring any government-issued laptop or phone or other electronic devices? Let alone, do you need to bring any of your personal electronic items that may have sensitive information on it? When you're traveling, don't look for electronic or video devices, surveillance devices in foreign hotel rooms. No need to check and try to ascertain whether where you're staying is bugged. And don't certainly, and this applies, of course, anywhere as officers, we shouldn't be engaging in any illegal activity, in particular while we're in a foreign country. And as just general guidance, always be aware of your surroundings. Trust your instincts, listen to your gut, and when in doubt, report anything suspicious. So what do you do if you get into trouble and you're in a foreign country? Well, first of all, remain calm. Help is available even when you're in a foreign country. Don't conduct your own investigation. If you're the victim of a crime or something suspicious you've been involved in, found yourself embroiled in, don't conduct your own investigation. What you should do if you feel threatened or you need help, you should immediately report that information to the local police if a crime has been involved, and then also reach out to the U.S. Embassy and or the closest U.S. consulate to where you're staying. I hear some background noise. Someone might have their line not muted. So there are these lines that I highly encourage you, if you are engaging in foreign travel, put these into your cell phone. So put into your cell phone, because these are available to you 24/7 to assist with emergency. Remember to put the 1 for the country code in before these numbers, because you'll be overseas and you'll have to put that in. So it's great to have it already in your phone if you are in emergency. So put 1 before both of these 202 numbers. Have them saved in your phone. It will connect you to the Office of Overseas Citizen Services and the Bureau of Consular Affairs within the State Department. And I also recommend that in advance of your travel, you take a look at where you're going to be staying and enter in the phone numbers for the local consulate or embassy, and that would be a number that's a local in-country number, and so put the entire string of numbers including the country code. But having those handy so you don't have to look them up in case you need them during an emergent situation, it can be critical. Upon return, we talked about ensuring you get your follow-up form submitted within 5 days, and if you were involved in any particular incident that involved a security threat to you or to any federal assets, be sure to, don't delay, reach out directly by email or fax to give the details of the situation. All right, now we'll transition over to assignment pay. So assignment pay, the authorities for assignment pay are found in a Commission Corps directive, Commission Corps instruction, and a Personnel Operations Memorandum, POM. The CCD was recently updated. That was initially released in 2018, and so we have an updated version of the CCD. And then the CCI and the POM to go with the CCD were recently released, and the original version is the January 2021 versions. So first thing to think about when you're looking at what do I qualify for assignment pay, there's three main criteria that I'd like you all to think about. So the first is the category criteria. So am I in a category that either provides direct patient care or supports the clinical care mission? Okay? And so eligible categories and professions include, but are not limited to, categories and professions such as the medical category, the dental category, HSO, optometrists, physician's assistants, nurses and nurse practitioners, pharmacists, etc. So, and those lists of eligible categories and professions are found in the Commission Core Directive. Position criteria. So think about category, next think about position criteria. So does this position that I'm in, if I'm in a qualifying category, does it qualify? So qualifying positions are those that involve direct patient care or overseeing the provision of direct care. So you're a first-line supervisor of someone that provides direct care. Your position provides support for patient care. So you are supporting individuals that are providing direct patient care. And lastly, your position involves the leadership, so that's providing the administration or management or oversight of the provision of direct patient care within an organization. And those positions are typically multidisciplinary. So, for example, a chief executive officer position at a IHS service unit. Last, I'd like you guys to think about this in terms of the officer criteria. So, is the individual officer criteria. So, do I fit within the category? Am I in the right position? And am I, as the officer, do I qualify? So those criteria include, I must be at the rank of 06 or below, must be assigned to a specific position that we just talked about the criteria for. My duty status, so I need to be in a regular duty status. You can be temporarily on a TDY, a temporary assignment for up to 6 months and still qualify, or deployed for up to 6 months. But otherwise, that needs to be your position is at your full-time position, be in a full-time qualifying position. You must meet the conditions of service, not have any performance issues. So your most recent core, the most recent core that was released. So if you didn't complete the most recent core, you're not eligible until you do so, and you must be have an overall rating of at least satisfactory, and you must not have any conduct issues or be under investigation for any. Okay. So there is an active duty obligation associated with assignment pay. That it begins with the effective date. That active duty obligation can be served concurrently with other active duty obligations that an officer might have. And so that can include if the officer has a health profession special pay, such as an incentive pay, board certification incentive pay, a session bonus, or a retention bonus, that they are receiving those pays and have an active duty obligation for those HPSPs, they are also eligible to receive assignment pay if they are otherwise eligible to receive it. The only two caveats here are officers who are completing an active duty obligation pursuant to being a senior co-step, or officers that are graduates of USIS that have not yet completed their residency training. They're not eligible until they complete those time periods. But everyone else would not have any active duty obligation considerations. Now, the active duty, the obligation or the agreement length ranges from 2 to 4 years. And when you review the PALM, you'll see how the pay rate does vary by length, the specialty, and the location. So in other words, if you agree to a 4-year obligation, your monthly amount, bear in mind these are paid out monthly, your monthly amount will be higher than if you've agreed to a 2-year obligation. Now, another important consideration is reassignment. So if you enter into an assignment pay agreement, you must get approval for reassignment, and that request for reassignment must be made by the operating division. So in our case, the Indian Health Service would make the request to Commission Corps headquarters for you to be reassigned. And there are different levels of approval for that request that depend on whether or not the position that you are seeking to be reassigned into, how that falls in terms of the relative eligibility for the assignment pay rate. So let me explain in another way. So if, let's say you are receiving $1,000 a month in assignment pay and you want to transfer to another position, that position, of course, would also need to qualify in most cases to be assignment pay eligible, and the position you're going into would have to have an assignment pay rate that's at least equivalent, if not higher, than your current assignment pay rate. Now, so when you complete the transfer, does that mean that you get that higher rate if you're transferring into a position that is eligible for a higher rate? No, it does not. You continue to receive the assignment pay rate in accordance with your original agreement, but you may be allowed to do so subject to the approval of the Director of Commission Corps Headquarters. And so the Surgeon General can only approve transfers into positions that result in a lower rate of assignment pay, and the ASH can only approve transfers into positions that are not approved for assignment pay, only if it's in the best interest of the government. So by and large, the expectation is that you would remain in the position in which you agreed to when you entered into your assignment pay. If you have questions, please, there can be a lot of other variables that come to bear for unique situations, and that's what we're here for within the Division of Commission Personnel Support, help out with that. And if you want to see the currently approved pay rates by length of agreement, specialty, and location, I encourage you to look at POM 821.79. So, last slide. So officers will continue to receive assignment pay until the completion of the agreement, even if the site no longer meets the site qualifications. So what are those site qualifications? And we'll circle back to complete the answer to this. So there are location factors that come to bear. So in order to receive assignment pay, you must be at a location that is either designated as an isolated hardship site, and for a list of isolated hardship sites, you can refer to the current awards policy. So if you're at an isolated hardship site, the 2-year vacancy rate for that isolated hardship site for your profession must be greater than 15%. And if you are at a non-isolated hardship site, then the 2-year vacancy rate must be greater than 30%. Those vacancy rates are provided by the agency to Commission Corps Headquarters by 31 July of each year. So IHS will be providing an updated list of our 2-year vacancy rates by position and site to Commission Corps Headquarters the end of this July. And subsequent to that, CCHQ will update the pay rates and the locations. So how do I apply for it? So there's a form that is available on CCMIS in the forms section, and you complete the PHS 7086 agreement form. Bear in mind, we have noticed that accessing the form with Google Chrome doesn't always open the form up. So if you are accessing the form and run into issues with Google Chrome, the recommendation is to try Internet Explorer. DCPS, we're finalizing our assignment pay agreement submission process, so that will be forthcoming soon. We anticipate that the submission process, which will involve the use of the form, will in many respects mirror the process that we have in place for HPSP agreements. Thank you for your attention and the opportunity to share these two topics. Turn it over to Captain Watson.
Yes, hello everybody. I'm glad to be here today to assist in this presentation. And I am the Western Region Liaison, and we're going to go over, there were only 2 questions submitted ahead of time, and I'm going to go over those questions. The first question is an HPSP question, and this question reads as follows. Is the retention bonus being extended for officers whose retirement was delayed by the stop loss? I signed a 2-year contract that would have allowed me to retire on January 1st of 2021, but since I was not allowed to submit my paperwork as originally planned, it pushed everything back, and I will not retire until May 1st of 2021 because in order to give separations a minimum of 120 days notice. And the answer to that question is that the only way that an HPSP RB agreement can be extended is through a new agreement. And due to an upcoming retirement date, a new agreement is not an option in this particular situation. The next question was related to hazardous duty pay. Since I am retiring, and actually it was from the same officer, since I am retiring on May 1st of 2021, will I be eligible for any hazardous duty pay or other compensation that may be back pay to USPHS officers during the COVID-19 pandemic? And the answer to, and the response to that question is that Commission Corps Headquarters at this time has not provided any guidance on hazardous duty pay. And that was all of the questions that were submitted ahead of time. The next item on the agenda is the live questions that will, if any, are submitted in the chat box. Thank you.
Good afternoon, everyone. We have a question in the chat box that is from Charles Thompson. It is an eCourt question. If the system can be updated to notify officers of approved leave once your leave granting authority has approved the requested leave.
I'll go ahead and take that question as far as eCourt is concerned. So I know initially when eCourt was launched, there was a notification system both to the officer and to the supervisor. They removed that actual application to the program because it was repeating and sending out multiple notifications for the same leave system. So they had to temporarily remove it off of the eCourt to see if they can reprogram it. I don't think that they've actually solved it just yet, but I will definitely bring it up in our next eCourt liaison call to see if it can be something that's applicable to be re-put back into eCourt. Thank you.
We have another question from Alexander Varga. Basically a question about the assignment pay and the eligibility requirements. Basically asking if tribal facilities could be included. Is this by design or an oversight?
This is Captain Verdugo. I will address that question and invite any other comments after I do so. So what you see in the POM represents the vacancy data that was provided to Commission Corps Headquarters. We intend to work with our tribal partners and urban programs, that staff officers, so that we can collect vacancy data so that we can ensure that that is provided to Commission Corps headquarters so that those sites and officers stationed there can be considered for assignment pay as well.
Thank you, Captain Verdugo. Operator, do we have any questions on the phone line, please?
To ask a question, please press star 1, unmute your phone, and clearly state your question. Again, to ask a question, please press star 1 and unmute your phone and clearly state your name for question and introduction. One moment.
Captain Verdugo, we have more questions in the chat box addressing assignment pay, tribal positions in Alaska, forthcoming. Also, if the service member can take it upon themselves to provide vacancy data to headquarters. If so, what is the process of getting that submitted?
So as we mentioned, we will be working with our tribal and urban partners to collect vacancy information so that that can be considered by CCHQ for future iterations of the assignment pay site eligibility list. Officers themselves don't need to do anything at this time. We will be working with leadership of our tribal partners and tribal sites and urban programs to obtain that information.
I have no questions at the
We have another question from Alexander Varga. Is there any updates on internal deployments? Deployments in general.
I will go ahead and take that question. This is Robin Davidson. Currently, because internal deployments are still ongoing, each region is managing a list of those internal deployments. I would recommend reaching out to your regional liaison if you are on that internal deployment list, and they can verify if you are on that internal deployment list. Thank you.
We have a question in the chat box from Commander Josh Sims asking about deployment. Been activated on deployment we are being told 30 to 45 days of travel orders to supervisors and tribes. We are wanting to know the length of the deployment, and basically that's just the length.
So I'll go ahead and answer that question for Commander Sims. Currently, CCHQ is matching officers to the deployment roles. It really depends on that deployment role. So we have seen a few for 14 days. We've seen others for 30 days, and we do have a few that are 60 days. So it really depends on which role you are being matched to. But we have requested consideration for IHS officers to not be deployed more than a max of 30 days. Now, that is just a consideration. Really, in the end, it is still up to Commission Corps headquarters, depending upon the mission.
Thank you, Robin. Operator, do we have any calls on the line?
We have no.
Okay, we have a question in the chat box from Kristen Smith, basically asking the eligibility for a pharmacist and eligible for RB.
This is Captain Wantz. I'll answer that question. So at this current time, based on the policy that was issued on January 11th, 2021, pharmacists are authorized for IP, However, the amount is zero basically for RB. So basically the answer is no. At this time, pharmacists are not eligible for retention bonus. Thank you.
Thank you, Captain Watts. Another question in the chat box from Patty Rona asking expanding assignment pay to other categories.
This is Captain Verdugo. So eligible category, I'll just read from the Commission Core Directive, and I encourage you to take a look at that. But essentially it says eligible categories, professions, specialties. Categories, professions, or specialties are limited to specific critical need categories, professions, or specialties that provide clinical patient care, such as medical, dental, optometrist, nurse practitioner. Bear in mind, folks, if that says e.g., for example, it does not, I don't interpret that to mean that that is exhaustive or limiting, but I'll let you review it yourself, because ultimately the eligible positions have to also have associated with it the appropriate vacancy rate or support the clinical healthcare mission of the USPHS Commission Corps, such as engineers. So it could be possible because the leadership positions, the multidisciplinary leadership positions can be encumbered by, they're multidisciplinary, so they can be encumbered by any number of positions. If there was adequate vacancy, if there are sufficient vacancy rates for that position to support it, it is theoretically possible that you could have other categories, such as environmental health officers, be eligible.
We have another question, and I believe it's again about assignment pay, Captain Verdugo, from Captain Andrea Bataccio. I apologize if I said that incorrectly. So basically, is the AP started off stating that it's for positions in direct patient care, yet numerous types of direct patient care providers were not included. Why?
Again, encourage you to take a look at the CCD. It provides examples of certain professions that provide direct clinical care. But I don't believe it's intended to be an exhaustive list.
Thank you, Captain Verdugo. Another question from the chat box. We have another question asking about the foreign travel leave, asking basically the territories where this applies and the clearances, i.e. Caribbean islands, Dominican Republic. I'm guessing U.S. territories. Oconus. Thank you.
So looking at the question, it is required of all officers because all officers should have at least a Tier 3 level, which is equivalent to a sensitive level position designation. And so all officers do need to submit the travel request form, and it applies to all foreign travel. So if you're going to a location that's not a part of the United States, then you would need to submit that documentation.
The next question is from Commander Woods. Captain Verdugo, I believe this is a question that is getting into some details as far as assignment pay. If you would like to maybe pick that up offline.
Yes, thank you, Commander Woods. Let's connect offline. There's quite a bit here, and we can, if it's okay, take a look and delve into the specifics of this situation and how best to apply it, and we can share that with the rest of the officers.
Thank you, Captain Verdugo. Dexter, do we have any calls?
We have no questions at this time. like to ask a question, please press star one, unmute your phone, and clearly state your name for question introduction. One moment.
Thank you, operator. We have another question in the chat box from Patty Rona asking about eligibility and credibility for the 2020 FMRB. If it is not posted in Red Dog or RDB, how long will it take to update?
So I'll go ahead and take that question, Mr. Colley. For the deployments that have occurred in 2020, if they've not been updated on your Red Dog, I do know that the Readiness Deployment Group, they do the FMRB review once a quarter. Because our current deployment posture between COVID-19 and now the UC mission is still ongoing, we can definitely take a look at individual situations and see to make sure that if you are eligible and you met all the criteria, including having the minimum required days of a deployment, we can most certainly address it with Readiness and Deployment Branch to make sure that they consider you for that FMRB. I would recommend reaching out to your regional liaison just so that we can double check all the criteria for the FMRB or Field Medical Readiness Badge for consideration. Thank you, ma'am.
I have no questions.
Thank you, operator. Thank you, Robin. Another question in the chat box. This is referring to deployments, basically seeking some guidance on the timeline. If they've been activated and received emails, also if any information has been updated to the previous email that have gone out for deployments.
I'll go ahead and take that question also, Mr. Hawley. Because the COVID-19 and now the unaccompanied children mission is so fluid and the requirements are changing, I can only ask officers to please be patient. We did have a conversation with Commission Corps headquarters today emphasizing notifications of officers in a timely manner and notifications to us as liaisons in a timely manner. So I can say that as missions are brought up and officers are matched, please be vigilant. But please also continue to do your day-to-day activities until you are contacted by Commission Corps headquarters.
Thank you, Robin. I think we have another follow-up. This one's from Garrett Steiner asking about possibly, I'm thinking, responsibilities and duties that are TDY from the service unit. I'm guessing probably making appointments if they're activated or could possibly be deployed. He would like to know if there's a time when they would be notified if they're no longer activated.
So I guess I will answer that question to you, Mr. Colley. I will tell you, yes, officers are being encouraged to limit their leave at this time just because of the fluidity of the mission. What I would recommend is that if you do have projected leave or if you do anticipate leave, even if it's in an emergency state, please reach out to your regional liaison, and that way we can then, really address it and then make a determination if in case we need to make a notification to the group. Thank you.
Thank you for that answer, Robin. We don't have anything in the chat box, but there is a few typing. Another question from the chat box, Robin, on deployments. Officers were wanting to know the difference in activated and rostered from S. Sherling.
Absolutely, Mr. Colley. So about a week and a half ago, CCHQ sent out an activation email to officers identifying the activation of the potential deployment for the unaccompanied children mission. Activation really truly means that you're on alert status. However, Indian Health Service has gone back and asked for our mission critical and our officers to be honored so that we can then truly look at our officers to make sure that those that are deployed can deploy in conjunction with our area director's approval. Those that are rostered means that they have been assigned an actual position to deploy, and really in the end when you're rostered, it means that we're just waiting for your itinerary to be completed by ASPR and submitted to you.
Thank you for that, Robin. We have one more, I would say more expressing concern on deployments from Mike Reed, if you would like to discuss with him offline, and the preparedness for deployment and the time frame. Other than that, I don't show any other questions in the chat box.
Absolutely. Captain Reed, feel free to send me an email and we can discuss your concern, sir.
Okay, I still show no questions in the chat box. Dexter, do we have any calls on the line?
I have no questions at this.
So, Mr. Colley, I wanted to go back up to Garrett Steiner's question because I'm rereading his question. And really the question is, how should officers navigate their work responsibilities that require TDY travel if activated for deployment? If you are placed on TDY and you are notified of deployment, I would say, sir, please reach out to your regional liaison immediately. If we need to make an alternate back to Commissioner Corps headquarters, we can, but really I think it depends on the circumstances, depends on where the TDY is at, and depending upon several factors that probably we need to consider. So I would definitely recommend reaching out to your regional liaison if you are in a TDY status and you do get called for deployment, sir.
Okay, no questions in the chat box. One more time for the operator, please.
If you'd like to ask a question, please press *1, unmute your phone, and clearly state your name for one moment.
Okay, we have Captain Bottaccio typing. Is there still no calls, Dexter?
No calls, no questions.
Okay, thank you very much. I'm showing no calls in the chat box. And I will turn it over to Captain Barnett for closing remarks.
Good afternoon. This is Robin Davidson again. I greatly appreciate all the officers who were able to join in the April all-hands call, and really appreciate Admiral Buchanan being able to dedicate some time to provide his comments for our officers. I greatly appreciate it, sir. We wanted to provide the DCPS website that provides a lot of information. And again, our next IHS Corps Officers All-Hands Call will be 5 May 2020 at 3:30. I encourage officers, if you do have any questions between now and then, please feel free to reach out via the IHS Corps inquiries at ihs.gov. or you can also see the website to list all the regional officers and regional offices if you have any further questions. Again, thank you. Appreciate your time. Appreciate all your questions. And you are free to drop.
This concludes today's conference. You may disconnect at this time. Leaders, please stay on the line for final line comments. One moment.